Wednesday, February 20, 2019, HealthDay News. Apart from the health benefits that weight loss surgery can bring, a new study shows it could boost a patient's life. Even better, that boost may often be a lasting one. After tracking the impact that weight loss surgery had on the life of about 2,000 patients, investigators found that roughly half reported notable improvements in their overall UAL experience as much as 5 years after surgery. We evaluated 4 aspects of UAL functioning in this study, including frequency of desire, frequency of activity, degree to which physical health limits UAL activity, and satisfaction with UAL life, explained study author Christine Stephan. After comparing pre-surgery reports with post-surgery experiences, she and her colleagues concluded that an improvement in UAL satisfaction generally persists over 5 years following surgery in both women and men. Stephan is a professor in the Department of Pharmaceutical Sciences in the School of Pharmacy at North Dakota State University, in Fargo. The study participants had an average age of 47, and the majority of them were women. All had their first weight loss procedure, in most cases a Roux-en-Y gastric bypass, at one of 10 different hospitals across the United States at some point between 2005 and 2009. Prior to surgery, all of the patients were severely obese, with an average body mass index approaching 46. Body mass index, BMI, is a measurement based on weight and height. For example, a person who is 6 feet tall and weighs 339 pounds has a BMI of 46. The investigators did not ask patients whether a poor life was a primary motivator for wanting to undergo surgery. However, the team noted that before surgery about 70% of the women and 74% of the men said they were not satisfied with their life. About 60% of women and 67% of men also specifically reported having pre-surgical physical limitations when it came to UAL activity. 1 year after surgery, about 92% of the patients were subsequently asked about their UAL function during the prior month. Among those who had indicated UAL dissatisfaction pre-surgery, 56% of the women and 49% of the men said things had improved meaningfully. In turn, about 1,400 patients were tracked for another 4 more years following surgery. Stephan noted that at that point, there were fewer women who still had improvement in most domains at year 5 compared to year 1, suggesting that not all improvements observed early after surgery are maintained in all patients over time. Even so, Stephan said that by the 5-year mark, 1/3 of the women still reported post-surgical improvements in terms of the frequency of their UAL desire and overall UAL activity. 5 years out, more than half also said that they had fewer physical health limitations when it came to UAL activity, and more than half still indicated being more satisfied with their UAL life. As for men, Stephan said that most continued to report sustained improvements in their life at the 5-year point on all fronts, except in terms of physical health limitations. Still, 68% of men said that such UAL limitations continued to be less of a problem 5 years out. Stephan noted that a drop in depressive symptoms seemed to be associated with improvements in UAL function among both men and women. The team did not, however, evaluate the impact surgery may have had on erectile dysfunction, saying it remains unclear how much a role that factor may have played. The findings were published online February 20 in the journal JAMA Surgery. Dana Tellem, who co-wrote an accompanying editorial, is an associate professor in the Division of Minimally Invasive Surgery at the University of Michigan. She said the findings are not unexpected. It is common after bariatric weight loss surgery for patients to feel more energetic and see reductions in weight-related medical conditions that can impact UAL health even within the first few weeks of surgery, she explained. Thus, I am not surprised that for many patients this would also translate into improved UAL function, but Tellem added that the investigation highlights a somewhat non-traditional angle on the potential benefits of bariatric surgery, which could help to reduce barriers such as bias and stigma surrounding the operation. More information there.